Welcome to another episode of Women in Focus. Our woman in focus today is Sareena Pisani, a doctor. So I will be asking her all about how I should be at this age looking after myself so that I can live to 100. Sareena, you're most welcome in our program. How are you doing?
Thank you so much for having me.
So when we were talking and you told me you're a mother of two, I said, I think you're 18 years old, but you're a doctor.
I'm older than I look.
That's beautiful, beautiful genes.
Yes, yeah, I get them from my mom and my dad, so I'm very lucky.
For sure. So why, did you always want to be a doctor?
You know what? Initially, I wanted to be a lawyer.
A lawyer?
Yeah.
You know, you're the second person in the last 1 week that has told me that they wanted to be a lawyer.
Yeah.
And then went into a different profession. I wonder what is law got to do with all this?
I think, you know, as a child, I was just always very curious about everything, curiosity. I was always out playing outside, looking at spiders. I would collect spiders and drive my mom crazy collecting them in jars, or being out in the ocean and by the seaside. I was just always fascinated with life.
Yes.
And, you know, human life.
Yeah.
So I think that's what sparked my interest in becoming a doctor, is just the science.
Really? Was there a moment that you can attribute to your desire to become a doctor? You know, sometimes there is a catalyst.
Yeah.
Was there one in your life?
Yeah, my mom. So my area is endocrinology, which is the study of hormones.
Okay.
And within that, I have taken a special interest in women's health.
Lovely.
So I think for me, it's watching the women in my life, and we're multitaskers. We take care of our children, we take care of our spouses, we work in the home, we work outside the home, and we're caregivers, we take care of our parents at different stages. But I think watching that, sometimes we don't take care of ourselves.
No.
So that, I think, was my driving force, is watching the women around me and, you know, realizing that, hey, women need to care about their own health.
Right.
So that was probably my biggest catalyst.
And you know, there are more studies done for men's diseases than for women.
100%. I think so. The research actually proves that women are the most understudied when it comes to health.
Wow.
Between the age of 30 to 60 and beyond, all the studies that you see out there about heart disease and everything, women are the smallest enrolled group in those studies.
Is it because women do not go for these studies, or is it that there is less interest in that?
I think it's multifactorial. I think we're busy with our lives, and we put that part of our life on hold a little bit in the child rearing stages, and then, you know, as we get older. So we kind of, I don't know, I think if someone asked me to be in a study with a 2.5 and a 5-year-old right now, I'd probably say no. Just the time.
And I think that's what happens. And also, women have so many different, as you mentioned, multitasking, so many things that they're doing. This is an additional burden on them, right?
Exactly, but we need to stay healthy to be all those things. And we do need to prioritize our health. So I think that's my biggest, it's not a specific moment in time, but just a broader overview of what women are, and that we should put ourselves in the forefront a little bit.
Now, when you decided for women's health, specializing, so are you working with women's groups right now? Where are you working right now?
So I currently work in Surrey.
Okay.
I'm the founder and medical director of my own clinic. It's the Mercer Clinic, and it's across the street from Surrey Memorial Hospital. Okay. I also am part of Surrey Memorial Hospital, or work for Fraser Health Authority, and I do general endocrinology, so that encompasses diabetes, osteoporosis or bone health, cholesterol issues, but I also have a special interest in menopause and polycystic ovarian syndrome for women.
Wow. Yeah. Now, the three ailments that you mentioned, women are number one in those: osteoporosis, lack of good bones, right?
Good bones, calcium.
And all that. And then diabetes. And South Asian women probably go through all that in their life. And is it true, or correct me if I am wrong, that when a woman is giving birth to a child, her calcium is depleted as she's giving it to the baby.
Yeah, so when we're pregnant, we do actually require higher calcium intake.
Okay.
Vitamin D is what's used to absorb calcium in the body, so often women don't know that they're deficient in vitamin D. Those are important in pregnancy, but they're even more important as we go through menopause or perimenopause, the stage before menopause. Because we don't build bone after that. We actually reabsorb our bone mass. So, you know, up until your mid-30s, you really should be focusing on your calcium intake, vitamin D intake, and even strength training to build our bones and build that, because we will need it later in life when we go through menopause.
South Asian people usually do not take vitamin D because vitamin D is you know, we think that because we've got darker skin, we've got a lot of sunshine. Doesn't vitamin D have something to do with the sun?
We do get vitamin D from the sun, but because of where we live in North America, we are not out enough, and we don't get enough direct sunlight. So mostly everyone in Canada does require some vitamin D replacement, and women who are postmenopausal, it is in the guidelines that we all require vitamin D supplementation.
So when you see, being in Surrey, obviously majority of your people may be South Asian women. Do you see a lot of ailments with them? And
so South Asian women in particular, due to genes and lifestyle factors, are at most risk of both diabetes and osteoporosis.
And osteoporosis,
yeah,
okay.
And
what about heart?
With that, heart disease as well for the diabetes,
Mm.
So we are at higher risk. They have proven that through studies. And I think I want to get the message out there is the screening. We should be screening for diabetes, screening for your bone health and bone mass, and making sure you're taking preventative strategies in advance.
I want to talk a little bit more about you and how you got into it.
Yeah.
Shall we take a short commercial break and come back? Get the program paid for.
Yeah.
Sareena is a woman in focus today. Don't go away. We'll be right back. Welcome back to Women in Focus. Our woman in focus today is a doctor. Her name is Sareena Pisani, and we were talking about you becoming a doctor because you looked at
Burnaby.
In Burnaby.
Actually,
Okay.
So yeah, I was born and raised in British Columbia. We grew up in Coquitlam.
Right.
Yeah.
And how many siblings?
So it's just me and my younger sister.
Lovely.
She's an accountant. She currently lives in Toronto.
Oh, wow.
And we were very close growing up.
I was just going to ask you, how close were you? I mean, you know, when there are only two kids in the family, they are very close, or?
We did everything together. Our family was very close knit growing up.
Yes.
We were, you know, we fought about clothes sometimes, but for the most part, we actually danced together competitively for many years, and we would do duets together in tap. So yeah, she's a very important person in my life. And
now, from your last name, I know that you're an Ismaili.
Yes.
So, are you a devout Ismaili?
Yes, faith and culture is very important to me.
Yes.
It's, I think, given me the strength to be where I am today.
Beautiful.
It doesn't matter what religion or what culture, but I think, you know, everyone needs that
grounding.
A grounding.
Yes.
Yeah, it's so important, and I hope that I instilled that in my children.
Oh.
Yeah.
Now, that part is going to be an interesting one as to how you met the guy that you married and your, you know, sweetheart and your kids. But we'll come to that in a minute. So, as a child, growing up in here in BC, you wanted to be physics and all that was your main
I did all
aim.
the sciences, but I think it was my parents. They worked very hard. They had their own businesses, watching, and you model. You become what you model, right? Or they model to you, and you become what you see, right? So that's one sense, is that they worked very hard, and we saw that. Secondly, the faith and the community and being part of that bigger belonging. I think it plays a lot in, like, you know, children face a lot of depression, anxiety these days, so having that grounding as well, but being also just well-rounded. So my parents made sure we were involved in activities, community, volunteer work, I was a competitive ballet dancer.
Yeah.
So we were busy, you know, they kept us well-rounded and busy so we didn't get into trouble.
Now, you know, when you become a doctor, there are only a few options that you have.
Yeah.
And there are just a few seats available, say, for example, in British Columbia, or you go to Ontario, or, you know, Montreal. But you couldn't find any place here, or you didn't want to wait?
So I did my undergraduate degree at McGill.
Okay.
Okay. When you are not a resident of that province, there are fewer spots.
Okay.
So in British Columbia, we have just, you know, University of British Columbia for the MD program.
Right.
So I applied a couple times, I was waitlisted, and I decided I didn't want to wait too much longer.
Yeah, because it's not a 2-year course.
Yeah.
It's like, what, 6 years?
Well, 4 years after you finish undergrad.
Yes.
And then, you know, you specialize, you go through residency training for another period of time. So I think from all my education together, it's been 15 years.
Oh my God.
Yeah.
So by the time you are of earning age, no wonder doctors mint money, because for the first 15 years, they have not made any money.
Yeah, so I'm only 5 years really into practice.
Right.
So I decided to go abroad. I went to the College of Surgeons in Ireland for medical school.
Yeah.
And there you have to work really hard to come back to Canada.
So when you come back to Canada, did you get your residency here, or did you have to go to US?
No, so I knew, okay, I'm taking the step, I'm going abroad.
Right.
But I accepted that it would be very difficult and I might not be able to come back. So I did all my exams, both US and Canadian exams.
Really?
And I applied everywhere.
No kidding.
And I was very fortunate that I got placed back in Canada. I went to London, Ontario, to Western University for my general internal medicine training.
Okay.
And then I subspecialized into endocrinology for another 2-year program at University of Toronto, where I was the chief resident.
Now, obviously, you're not scared of blood or...
No.
Because you wouldn't go to surgery, would you?
You know, initially I thought I was going to become a gynecologist.
Okay, all right.
But yes, the surgical aspect wasn't quite for me.
Yes.
And I, you know, discovered endocrinology and just had such a passion for it.
Right.
So I decided to devote my time.
So under your field then, when the patient that come to you, or the profile of a patient, what is the age group that we are looking at?
So I'm an adult endocrinologist,
Okay.
so anyone over the 18 and older.
Okay.
But it is a very broad field. We deal with all hormones and organs, so the pituitary diseases, diabetes, bone, adrenal diseases, thyroid, reproductive system, both male and female.
Female, right.
So it's a broad, I would say there's no specific, but because of my special interest, I deal mainly with women.
Now, when women come to you, do you usually notice that, does it have, the ailment that they have, does it have anything to do with their lifestyle, their eating habits, or the place that they're living in?
All of it.
All three of them?
It's, I mean, you know, there's genetics.
Yes.
Then there's like cultural and lifestyle,
Yes.
right? So, you know, exercise plays an important role. What we're eating plays an important role. Stress management plays an important role. It's multifactorial. The genetics is there. We cannot change that, but we can change our lifestyle.
No pakoras and all that. No bhajiyas.
Balance. I think also when you come to a physician, you want a little bit of a patient-centered.
Right.
You know, I'm not going to tell you, okay, go home and eat no rotis, but maybe I can give you some advice on how to make your rotis healthier.
Right.
Right.
Bran.
Oh
my God! I'd rather
whole wheat. Spelt.
Salt and sugar.
Yeah.
2 things, right?
Yeah.
So, do you ask your patients?
How much? So we have a dietitian in the office.
Right.
She's wonderful. We have an interdisciplinary team. So it's not just, I'm not an expert in everything. So what's important to me in my office is that we have, you know, a couple of endocrinologists, we have a weight loss specialist, we have a dietitian, we have a pharmacist, a nurse. Everyone adds their piece, right? But yes, salt intake is a big contributor to high blood pressure.
Right.
And sugar for diabetes.
Right.
So those things, you know, they're so important.
Two important things, jalebis, no jalebis, and no laddus.
Everything is in moderation.
Don't go away, we'll be right back. Sareena Pisani is our Woman in Focus today. Welcome back to Women in Focus. Sareena Pisani is our Woman in Focus today, an amazing doctor. I've got to come to your personal life, right?
Okay.
So, being doctor and being so interested in all physics and chemistry and all the sciences, how did you have time to fall in love and marry?
Honestly, I think it was fate.
Yes?
I met my husband in undergrad.
Oh.
At McGill.
No kidding.
But we didn't really know each other. We met in passing.
Right.
Okay, and he added me to Facebook, so social media.
Oh.
And then obviously we both worked on ourselves, our careers, and somewhere along the line, 10 years later,
10 years later?
10 years later,
wow,
he messaged me on Facebook to just ask me a question.
How were you doing?
Yeah, I was traveling, I think somewhere. I was traveling to Berlin, and I posted on my Facebook, can I get some recommendations on where to stay? And he goes, oh, I just came back from there. He was a consultant at the time for a big bank, and he was traveling all over the place, and so he gave me some recommendations, and then went on my trip, came back.
And then it was customary for you to tell him, thank you very much.
Actually, he messaged me, he goes, how was your trip? And we just started talking from there. Interestingly, I didn't know where I was going to be practicing at the time.
Right.
I was still in med school.
Right.
And 2 weeks later, I found out that I was coming back to Canada and in Ontario, where he was living at the time.
Wow.
And coincidentally, we're both from Vancouver. And our families,
he's from Vancouver.
He's from Vancouver. His whole family is here. In fact, my mother-in-law is a big fan of yours. So she, we both from here, living in Ontario, and eventually
what a small world.
Small world. And our families knew each other.
Oh my God.
Yeah.
And you never thought, you know, that way before.
Yeah.
Did you meet him before, you think, as a child?
As a child, my mom and his cousin were actually in like a mosque group together.
Okay.
And so he would probably come to the mosque when my mom was pregnant with me. So we were probably around each other, but we didn't know. Yeah. So I think fate had
I think a lot to do with it.
Yeah.
So how was the wedding? Was it a small wedding, big wedding?
I think it was small for Indian standards. Just 100 people here in Vancouver with our immediate family and friends. Yeah.
So you wanted it very intimate and all that.
The family.
And so both of you of the same faith.
Same faith.
And you have a couple of kids.
We have a 2.5-year-old and a 5-year-old.
Isn't that beautiful?
Olivia and Ryan, boy and girl, and they are just the light of my life.
Of course. So now, while you were pregnant with the kids, did you pursue your career till the last day of the pregnancy?
So my Olivia, I was pregnant with her in my residency program in Toronto.
Oh, wow.
And she was supposed to arrive 1 month after my graduation. But
she decided?
Came early, of course. She came 4 weeks before the graduation. So yeah, I had her. I went on maternity leave, then I finished my training for 1 month after I went back for maternity leave. But yeah, and then I wrote my exams when she was 9 months old.
How difficult was that with the baby and then writing your exams?
I'm lucky. I have a supportive husband. I have supportive mother-in-law, mom, dad, everybody supported me. They all helped me take care of my daughter, and my husband helped, and I spent the weekends, evenings I spent with her, and then weekends I studied. Yeah. Wow,
tough, because, doing exams and studying for
I worked
medicine and working.
Worked.
Medicine is like, you have to remember everything, right?
Yeah.
Now, your business, you said you've got your own business.
Yeah.
And it's called?
The Mercer Clinic.
Mercer Clinic. Why Mercer?
So, a couple of reasons.
Yes.
When I was in Ireland, one of the main clinics there on campus was the Mercer Clinic.
So you're affiliated with them?
Well, I'm not affiliated with them, but I do hold an appreciation to them because it's where I trained.
Right.
And then when me and my husband moved to Toronto, one of the first places we lived was a condo named Mercer. So it just kind of fit together. Nothing, you know.
That's a beautiful story for a company name.
Yeah.
So, okay. And you employ people there in your clinic?
Yeah, so well, not employ, but everyone's like a contractor and has their own practice.
Right.
But we help each other.
Right.
And we teach each other and we run cases by each other. And it's a nice environment to be in.
So you're in a very important field, which is women's health. And I think it is, if a woman is fine, she looks after the family, the kids, you know, parents, husband, everybody, right? So why doesn't the government pay attention to that particular field? Do you, I mean, I don't want you to rant against the government, but you know, I'm asking you a question. Does the government give any priority to women's health?
Yeah, so I think things are changing and evolving, obviously. So there's always more funding going into women's health. BC Women's Health Foundation is another big one, and they are putting more money into women's health research. So there's initiatives. It's evolving, and I hope it continues to grow.
Well, we hope that it does. Where do you see your profession taking you in the next 5-10 years?
You know, I hope that I continue to build my practice, build my business. I would like a one-stop shop where, you know, not just women, but men too. You can come, you can get advice from different types of experts under one umbrella instead of going, you know, running around to different areas. But it would be nice if there was interdisciplinary care in one place. So that's my hope.
I think that would come.
Yeah.
If you're determined, I mean, you were determined at the age of 10 to be a doctor.
Yeah.
So you can make it happen.
Yeah, I can make anything happen. So
that's true.
I think it's all about manifestation. So if you keep picturing it and you keep working very slowly, it will come.
I think Mercer will become bigger and bigger and bigger.
Thank you.
You know, Sareena, thank you so much for coming and being a woman in focus today.
Thank you so much for having me.
I've enjoyed this.
Me too. It's so nice to meet you and for having me here. I know that you've been a big part of my life. On the Rim Gym, my grandma always used to play just all day long in the background, and hearing your voice just brings me back to my childhood.
Thank you. Don't go away. We'll be right back.